Hello and welcome to the very first episode of Health Talk with Asif, an unprecedented podcast for doctors and health professionals. Our mission is to help you improve your English for giving presentations at conferences and communicating in the medical field. I am your host and I am thrilled to embark on this journey with you. Today we have a special guest, Dr. Gulshan Hasanova, who will be sharing her experiences and insights on a pediatrician's life, demanding work, and personal journey.
Thank you so much for having me on your podcast. Congratulations on launching this exciting new venture. I wish you all the best and look forward to a great conversation today.
Thank you, Dr. Hasanova, for joining us today. Let's dive in. Can you tell us a bit about your background and what inspired you to become a pediatrician?
I graduated from Medical University in 2004. Since then, I have worked a lot of hospitals, but now I'm currently working at Reference Clinic Nesmi branch as a chief physician and as a pediatrician. When I was a child, my aunt stayed with us during her medical education. And when she read medical books, I always tried to see all these photos and to show the bones which she brought from anatomy classes. It really excited me. Additionally, I always preferred to play with dolls, and I take care from them like a mother. I tried to feed them and treat them with injections. I know it wasn't usual behavior for babies, but I always care of them like a mother. And to this day, I feel like a mother to all babies. I think it's my inner calling.
Okay, thank you, and it's truly admirable. Thank you very much. And what do you enjoy most about working with children and families?
I want to say that really I enjoy with my patients. First of all, children give me strength. During my work days, when I examine children, I witness their unique voices, cries, and demands. And sometimes they even complain about their parents or sing a song for me. Almost every day, my nurse take a lot of photos with them, and then we share these photos from Instagram or WhatsApp. Almost every day, we take photos with babies. This gives me power. I have mature patients too, and my mature patients come to me like a friend. They seek advice from me, and I promise them to keep their complaints confidential. And all of this makes me stronger and increases my trust in my work and myself. These experiences make my work enjoyable, really.
Okay, wonderful. How do you balance your demanding career as a pediatrician with your personal life?
Oh, this question requires a broad answer. Of course, my family is an integral part of my life, and it's significant to balance between my demanding work and my family. I have responsibilities not only as a chief physician, but also as a pediatrician. That's why it is challenging to keep a balance between my work and family. I think I am fortunate because my family, especially my husband, always supports me and continues to do so. Of course, I will work in a big hospitals and take care of night shift patients until morning because I really love my work, my job. But considering that, I'm a mother and I'm a wife. And if I want to maintain balance, I have to accept everything 50-50.
Okay, thank you very much. What hobbies and activities do you enjoy outside of your medical career?
Of course, as a human being, I enjoy listening to music, traveling, cooking, eating outside with my friends, with my colleagues, and my family. However, considering my job, I don't have enough time to spend on my hobbies and activities. That's what is called balance. You know, if I want to maintain balance, I can't take time away from my work for my family or from my family for my work.
Okay, yes, that's true. Can you share a story of a patient case that had a significant impact on you?
Of course, I had a lot of different patients, but one patient really impacted me significantly. I had a patient I can't forget. One day his father brought he to me. Their complaint was a high temperature. I can't believe, but his father told me his temperature always 39, 40 degree. They did all the examinations. They did CT, MRI scan, X-rays, and virus analysis, but all results were normal and no one could diagnose him. And one day some of my patients recommended me to him. When I examined the boy, you know, I couldn't believe. And the boy's temperature was 41 degree. And the boy felt himself very good. You know, when we have a 38 degree, and we feel ourselves very bad. But this boy felt himself very good. Then I gathered my colleagues, and we discussed this boy with my team. And after discussions, we sent him for an EMG examination. After getting the results and consulting with a neurologist and psychologist, we diagnosed him with psychological hypothermia.
It's a very nice story.
Yes.
Okay, and memorable. Okay, how do you stay motivated and passionate about your work in pediatrics?
Okay. My job is very enjoyable and passionate job. Seeing the joy and relief on parents' faces when their child recovers keeps me motivated and passionate about my work in pediatrics. The trust and gratitude expressed by patients inspire me to continue providing the best care possible for their little ones.
Let me ask another question. What advice would you give to medical students considering a specialty in pediatrics?
My first advice to medical students is don't choose this profession without inner love. Pediatrics always connect not only with the patient, but also attentively with their parents. For example, endocrinologists and dermatologists only treat specific disease, but pediatricians are responsible for babies' development, psychology, and mental health. Secondly, as a pediatrician, you have to be a mother or a friend to your patients and their parents. They have to trust you. My first advice is please give children trust, and give children not only trust and self-esteem too. Give their parents hope that everything will be okay with their children.
Okay, thank you. Very nice advice, I think.
Thank you.
And what are your hopes and goals for the future of your career and the field of pediatrics?
You know, we live in a democratic republic. And every year, thanks to our president, we see how our medical field is growing, especially pediatric hospitals. These buildings are restored or newly built. For example, recently a pediatric hospital was opened in Baku by Leila Clinic, and it was a beautiful opening, and they created many pediatrics rooms with pictures and entertainment for children. And when sick patients come to this hospital, they feel happy. In our clinic, in reference to, we have a well-developed pediatric room, for example, my room, and our patients willingly come to my room for examinations. Finally, I want to say that our government is always ready for new openings and developments in the pediatric field.
Can you describe a typical day in your life as a pediatrician?
Of course. My typical day always start from 8 o'clock. Every day I examine a lot of babies, and my typical day starts early with rounds at the hospital, followed by seeing patients in the clinic. I spend my afternoons doing consultation, paperwork, and sometimes attending meetings or continuing education sessions. It's busy but very rewarding.
Okay. And how do you stay updated with the latest advancements in pediatric care?
Okay, staying updated is essential. I regularly attend medical conferences, participate in online courses, and read medical journals to keep my knowledge current and ensure I provide the best care possible.
That wraps up today's episode of Health Talk with Asif. Thank you for listening, and special thanks to Dr. Gulshan Hasanova for sharing her experiences and insights on a pediatrician's life, demanding work, and personal journey.
Thank you so much for having me on your podcast, Asif. It's been a pleasure sharing my experiences, and I hope my journey can inspire and help others in their careers. To all the listeners, keep striving for your goals and remember that balancing work and life is a continuous journey. Stay healthy and take care. Thank you.
You're most welcome. If you enjoyed this episode, please subscribe, rate, and review our podcast. Be sure to follow us on Instagram, Facebook, YouTube, and TikTok for updates and new episodes. Just remember, the more we learn and care for our health, the more we enhance our well-being and professional practice. Until next time, stay healthy and keep learning.